Going to tell us all about medical gaslighting, and I can't wait. Ellen?
Thank you. Thank you for having me here today. I'm really excited to be somewhere that isn't my guest room. I think I can take these off because the reflection is going to take me off. As the intro pointed out, I am with Pfizer. I'm the Senior Director of Digital Communications. I sit within corporate affairs, so everything I do is unbranded, which is very helpful because this is my first job in pharma. I joined, as I said, 6 years ago, and I came to Pfizer from publishing. So storytelling is in my blood. I think I curled up with a book at age 2 and just never let go of it. But you can see all that in my LinkedIn background. I think the best way to get to know me is to know the 3 things that I could talk about for 30 minutes without any preparation whatsoever. The first is skincare, especially TikTok and Instagram influencers and all the battles there. It was a very big rabbit hole and something to distract myself during the pandemic. And if anyone wants to talk about Michaela and the mascara, I'm here for you. Number 2 is Harry Styles, hashtag Cougars for Harry, anyone? I'm here for you. And that is pretty much my hashtag, so feel free to step on it if you want. And number 3 is Disney. Again, you can check out any of my social media channels to understand that. That is a picture of me with my pandemic puppy, and I could, again, talk about her for days, but we will move on. So at Pfizer, where am I pointing? Big green button. Do not do the laser because then you blind people. I was told that, and then, yeah, we forgot about that. So at Pfizer, you may have heard of us. We have been working really hard these past 175 or so years on a lot of things, but clearly our focus in the past three years has been on public health involving the COVID-19 pandemic. And I've been leading the team that has been working on communications revolving around COVID-19, specifically our vaccine product and Paxlovid. And one of the things relating to our overall purpose of breakthroughs that change patients' lives is fighting misinformation and helping to build public trust. We all know that there is a spectrum out there of individuals. And this was something that we talked about, gosh, I think as soon as we announced that we were going to put together a vaccine candidate with our partner BioNTech, that there were going to be some people that we were never going to be able to convince to take a vaccine or even think about it. And then there were people that we could say, inject this into your skull with a needle this big, and they were going to do it. And then there was the movable middle, and that was a spectrum in itself. And we just didn't know how we could break that up and reach them and how that middle was going to shift. And boy, does it shift constantly. So once the vaccine came out, once we saw how the roller coaster of public opinion went, we decided that it was going to be important to start to address a lot of the misinformation that was out there. And not in a typical pharma way. We wanted to be sure that we could reach people where they lived, whether that meant a funny TikTok video or a reassuring patient video or something where we were giving straight facts and information. One of the things that worked for us really well during the pandemic was having our leaders, trusted voices, give very simple information. Before we had a dog in the fight, we had our chief medical officer and our chief scientist officers just doing very simple videos on the importance of hand washing, the importance of 6 feet apart. And this was bringing people to our websites, to our social media channels, because they just wanted this info. And we knew that when we were able to provide that to them, very straightforward, they'd come back to us and we continue to build that trust. So when we looked at tackling misinformation, we came up with this campaign objective: creating innovative content, using external partners and influencers, seizing the moment. We wanted to debunk myths, misinformation and disinformation about vaccines and science, because it's bigger than just vaccines, in an effort to support our audience and promote public health. I promise I will not read every slide. I really hate when people do that. But this, I feel, is like a double emphasis, because this kind of, number one, does set up my whole presentation, but two, lets you know what we were trying to do. So when it came down to what we would do and what we wouldn't do, we set up a series of what we called rapid response decision factors, because a lot of times something would happen and we'd have to respond like that. So whether it was Jeff Van Gundy making a comment about, you're doing your own research, really? There are bench scientists who have been doing this for decades, but go ahead. Basketball player who may have done something bad to the Boston Celtics, so I've never personally liked that person, but there are other basketball players I really do like. Sorry, very big Celtics fan here. That might have been mocking the powerless. We don't make light of COVID or other diseases. Do we invite scrutiny or criticism around pricing or profits? No, that's not somewhere where we want to get into the discussion, because that's distracting. And trying too hard to be funny. Oh boy, did we step on this one a lot. There was a line, and that line was like a seismograph. But we decided that if we could go through the do's and the mays and avoid the don'ts as much as possible, it was worth taking the risk in most cases. And if it was something that we felt would make an impact with our audience, we did it. So these are some examples of content pieces that we put out in this area. The what the heck is that? Not language you'd expect a pharma company to use. And we had some people going, oh, Pfizer, interesting. I love the Could You Secretly Be a Scientist campaign, because that was fun. It kind of was a gentle jab at people who were doing their own research, but it made people feel engaged, and we got a lot of engagement on these posts. And then Fortune Friday, it had nothing to do with really science, but these were just fun posts with hashtags to engage people. And then we tried to do what we called first and pharma types of content. And let me tell you, the one on the left got good engagement, but everybody within the building was like, what is this? Somebody has to explain this to me. And I'm like, it's called a meme. And we're gonna talk about it. Maybe we're just gonna have a phone call and explain to you what a meme is. The one on the middle is really fun. They're trying to get to the other side. It's a chicken talking about the kids going to, I don't know if you can see it, it's a vaccination site. And the chickens are commenting on the family going into the vaccination site. And the other side is, you're vaccinated. Y'all are vaccinated, so I feel like this is a good joke. And then the dudes in November. Not everything had to be about the vaccine. Oh, Lord, not everything had to be about that vaccine. So when we were able to bring other therapeutic areas that we work on or other areas of science, we were eager to do that. And then influencers. Hang on, beverage. In two cases, I'll start with the ones on the right. We leveraged influencer voices to tell different stories we couldn't. I heard on the internet was a way for an actual scientist, Darren Wynn, who has an account called Lab Shenanigans, and he would debunk different things that you heard on the internet. You may have heard on the internet that getting the vaccine makes you magnetic. That's not the case, and here's why. So there are about 10 of them, and in each case, he'll debunk different things that you may have heard on the internet. And they're very fun. The one on the right is to mental health, and it talks about color theory as a way to boost your mood. As you can see, even though it's freezing here and a sweater was really the right call, I am all into color theory. This influencer is Courtney Quinn. Her account is Color Me Courtney, and if you are not following her, rectify this immediately. She is a ray of sunshine, and she will brighten your day like nobody's business. And our podcasts, we have some award-winning science podcasts that we've been able to put together. Maternal immunization is the new season of The Antigen, which started out, we did a podcast on vaccines before we knew, and then season 2 was on the COVID vaccine, and then season 3 on our RSV vaccine, and then season 2 of Science Will Win is out. Season 3 I'm working on now, and I'm really excited. Can't tell you what it's about, but trust me, it's going to be amazing. And then these are some other great campaigns that we've worked on. This is debunking. This is when we see things and we're like, okay, we've got to find some way to tell people that no, there are no live particles, you're not getting a microchip. So what we do here is get permission from legal to share either a Reuters or an AP fact check or something that's come out from a TikTok influencer, if it's even come to that. Some way to let people know that this third party has said, no, this is crazy, don't listen to them. So what more could we be doing? And that's where medical gaslighting came on. In one of my spare time moments, and I don't have a lot of them, I was sitting in an RFP for a new agency, and it was for migraine. I was listening to people talk again and again about these different campaign ideas, and I sat there after it, having that post-meeting discussion saying, do you think anybody on this last call has actually ever had a migraine? They're not understanding that it's more than a headache, that a migraine is debilitating, that a migraine can take over your life. And I said, for instance, my issue with migraine, it took me 2 years to get a prescription for a migraine. My first doctor didn't believe it. The second one said, oh, no, a neurologist has to prescribe it, and there are no good neurologists in New York City. Everybody had a story. There were 4 of us on the call, and we all had a story. And then I said, you know, listen to us. We're 4 white women of a lot of privilege. What if we weren't? What then? What would have happened? And that's what got us thinking about medical gaslighting. So what is it? Medical gaslighting is when you are not being heard by your healthcare provider. You're stereotyped, you're misunderstood, your symptoms are dismissed, or you're even blamed by your doctor. And when we started thinking about this, we thought, this is probably prevalent out there. It might be more prevalent in non-white individuals. It might be more prevalent than women than men. There were a lot of different thoughts that we had. So rather than just go out and do a campaign, we partnered with She Knows to do a survey of their readership because we wanted to let that guide the discussion. So we created 5 articles and 3 videos that told stories about let me back that up. We did the survey and we got the results. They were surprising to say the least. We used that to guide us in the campaign content. We created a series of 5 articles and 3 videos to tell stories about what the gaslighting was. And I'm very proud of this work because we got a lot of HCPs who raised their hand and said, we've seen this firsthand and we want to speak up and make sure that we can give hints on how to be an empowered patient. And Pfizer ended up creating our own patient literacy guide. It's a free ebook that you can download from our website. So there's a whole package of stuff that can link into this whole thing. So some of the surprising responses, 72% of people responding to the survey felt that they have been a victim of medical gaslighting. 71% of the total and 82% of LGBTQ plus respondents were told by a medical professional that their symptoms were made up. When we were putting together the survey, the gentleman from the survey company was saying, you know what, when my husband had COVID, and he had a very bad case of COVID, he was in the hospital, and they were asking him about his drug use. He'd never done drugs, and here he had COVID. And then they thought he was having a heart attack, and all he needed to do was get treated for COVID. But they were going through this whole litany of symptoms because he was a gay man. And every time we reached out to somebody to hear these stories, it was unbelievable what we were coming up with. What was not surprising was that HCPs find this as huge an issue, and they want to put a stop to it too. We're learning the consequences of medical gaslighting. It affects your mental health. There's emotional distress. Incorrect, no treatment, and longer diagnosis time. Now, I'm very lucky. I found someone at Pfizer, Dr. Tracy Wilson. She agreed to be in a video about this. She is a nurse practitioner in Houston, Texas. And I'm going to play part of the video until Steve stops me and says no. But this backstory behind this video is she was prepared to talk about endometriosis. because that's a condition that affects a lot of women, and especially women of color are getting misdiagnosed when it comes to that condition. She didn't know she had it. She went to a doctor's appointment, they did an ultrasound, and they found her fetus was sleeping on a little fibroid. So she was all prepared to have this conversation, and she's worked with me on this campaign. I got to her house, the lovely house behind her, and I walk in, ready to do the filming. She goes, "Ellen, great to see you. We're throwing out the script, we're changing everything, because I realized I had been medically gaslit, and I want to talk about it." I'm like, great! Is that great? That's okay, we're changing the script, we can do this. So I will start this.
Hi, my name is Dr. Tracy Wilson. I'm a doctorally prepared family nurse practitioner. I've been a nurse practitioner for 14 years. I live in Houston, Texas. I've been living here in Houston for a little over 3 years. I became a healthcare provider because of my mom. When I was 8 years old, my mom had to have a hysterectomy. And so she needed someone to clean her wound. And so she knew that I had a desire to become a pediatrician. And so I became her little mini nurse every day. That's what I had to do. Now, I almost fainted while I was doing it. That was my entryway into the healthcare field at 8 years old. So in 2015, I tested positive for strep and flu. I thought that it could be something a lot more serious going on. And so I went to the emergency room to seek additional care to try to figure out what else could it be. I thought maybe it could be meningitis. The doctor's immediate response was no. It's no way it could be meningitis. And I said, "Are you sure?" And she said, "You're not that sick." And so I went to another emergency room a couple days later because my symptoms had not gotten any better. And so the next doctor tested me, and that came back positive, showing that I had viral meningitis. And so just looking back at this situation, I now know and understand that I was gaslit by this healthcare provider, and I could have died. I'm a medical professional.
So it's a longer video. Mama had to be seen because Mama would not accept the fact that I would have cut her out of the video, because that woman was fabulous. She's been undergoing treatment for stage 4 cancer and sat through the whole shooting to cheer on her daughter. I mean, it's an amazing family. So in conclusion, I'm so proud of this campaign. I'm proud of all the work that we get to do to shed a light on these stories and, bring them to individuals that might not normally get a chance to hear them. And it's really the cornerstone of what I do at Pfizer and why I'm so proud to work there. So thank you very much.
Thank you, Ellen. We have time for a couple of quick questions. If any of you have questions of Ellen? Yeah.
Thank you so much for that. It was so great to hear that. And the gaslighting thing is super interesting, and I see connections maybe even with Evelfem and particularly around women's health. My question is, I was listening to you talk through the study and the survey results, and that you had a lot of HCPs that really want to stop this, but they're doing it. So how do you reconcile a community of providers that are saying, yeah, that thing is happening over there, but maybe not recognizing the days and the times in which they do it? How do you have that conversation?
Dr. Erica, I think that is a fabulous question. And the best answer to that is we're kind of getting started on this. We've just scratched the surface. The survey results came out in October, and we are now working on a media outreach plan for this whole campaign, and we're looking at where we take it in phase 2. We're working with our medical affairs team at Pfizer to brief them on how the survey came out, give them the materials that we've created as a result of the campaign, the different articles from HCPs on how to fight medical gaslighting, so that when they're working with their constituencies, they can hopefully share that. And thinking about that as a part of phase 2 of the campaign, so we can help elevate the voices of the HCPs that want to stop gaslighting and make sure that they can help get that word out there. So thank you for your question.
Yeah,
Hi, I just want to quickly build off Dr. Erica's question
Sure.
because I had a similar kind of train of thought when you mentioned the HCP's interest in, kind of rectifying the medical gaslighting. I have seen some research that kind of newer, younger docs or, HCPs have very different mindset or attitudes versus kind of quote unquote, traditional doctors. So curious if you have any research about either the types of practitioners or the demographics that are, really aware of this medical gaslighting issue.
Not yet. Thank you for your question. Not yet, because the survey was done of a patient population. So we are looking at a phase 2 of the campaign, or even a phase 3, where we talk to medical professionals and see, how it changes per age group, because you're right. There are some doctors in different age groups and different locations, geographically and in rural versus more urban settings, that treat this topic differently. And how can we, get that information out to them? I'm also hoping to partner with our women's health teams at Pfizer, because I think that's kind of the crux of where it is. I do always link it back to migraine in my head, because that's where the idea for the campaign came, and they're certainly very supportive of it. And I'm hoping to, our next video is going to be with an eczema patient, and it's a woman of color who also, skin conditions are often misdiagnosed, and it took her 3 years to get a diagnosis of eczema. So imagine the pain that you're going through for 3 years, the scratching and all that. So
I don't know if it's necessarily a question, but Eric, yes. When you started this, Shayna, who works on my team, said, okay, this is every one of our patients every single day. So it happens in women's healthcare a lot. And first of all, thank you for doing that and helping lead the way, because you gave us a lot of ideas. We have women who all the time say they're having symptoms, but the doctor says, well, we'll just change the pill type, right? Rather than actually look at what's best for them and their lifestyle and really consider what they're going through. So I'm kind of curious, do you have doctors who are upset and are offended?
not yet. Definitely not yet. I mean, most of them are kind of, and I don't know whether it's the equivalent of Dunning-Kruger effect. That they don't necessarily see themselves as gaslighters, honestly, or it's just, hey, how do we help with this? The response has been very positive so far.
Ellen is going to join with Danny at the end of the morning for a roundtable on social listening and using social channels, so you'll be able to dig in deeper there. Ellen, that was great. Obviously resonated.